So I just got off work not long ago. Got changed into my comfy stuff. Um, I did a I'm on a new travel assignment. This is only my third day on my own at this new travel assignment. I have a little bit of experience. I have 2 years as a nurse, a little over 2 years as a nurse, but about one of active work experience. And so travel is interesting. This is my third travel assignment. It's my third facility to work at, but my third travel assignment, two of them were to the same facility. And it's different. So I'm learning a lot. It is challenging. It's hard to get thrown into trauma situations where you know in theory, but you don't have the experience. And I'm so grateful for people that are willing to help you, and the other nurses are amazing. Sometimes doctors are great, sometimes they're not. There's some that are great, and there's some that are not so great, not so helpful as far as that goes. But I'm so grateful for the other nurses. It's a great facility to be at. I'm working in Waco right now, so it's a step down from the level 1 trauma center I was at and a step up from the critical access hospital I was at. But there, at every facility, there's just different rules and different ways you do things and different things that the nurse does. So I'm constantly learning, and there's days where you just feel like a complete dope, like you're asking a ton of stupid questions, but I think that's one of the good things about my personality, if I can give myself a compliment, because trust me, there's plenty of negatives, but we're going to focus on some positives. That's one thing that I would say is an attribute of mine, is I'm always good with patience, first of all, and I think that's important. But I'm not going to do anything that doesn't feel safe. I'm not going to do anything that I don't know how to do and just go in there and wing it. That's not my way. I will ask questions. I will gather information, find resources, and if that pisses somebody off or somebody's irritated with me because I'm asking them questions, or I'm, keep going and keep asking questions. I mean, there's a time and place. People say there's no such thing as a dumb question. There is. If you have the ability to find the answer on your own, but you're just asking the questions instead, that's lazy, So, but a true question, if you don't know how to do something and you're unable to find the experience or the resource on your own, it's a good idea to ask. So I'd say that that's a thing about me that's good, is even when people get irritated with the questions you ask or don't want to help, I don't care. Like, I might be new to this, but I don't care, because me asking the question, it's not about me. It's about that patient and what that patient needs, and knowing how to do what it is I'm supposed to do safely. And that's something that I'm going to make sure I do. So, starting a new job, sometimes it feels like there's a lot of negatives. It really highlights what you don't know how to do, and you're having to learn policy and the facility rules and just the way that they operate. So in the midst of that, that's at least a compliment I can give myself. And for today, I think that's the only compliment I have for myself. So we'll see what tonight brings.